put our hands together on the head of service for those very brilliant. Can I request that we all please settle down, and I request us to please rise to welcome His Excellency Mr. Governor Godwin Nomengase Obaseki, the Governor of Lord's Edo Pensioners. Can you give him a resound and applause? The Governor of Spain solemnly from December before the 10th of December, and has promised the 13th month by the 27th of December, the first of his kind in Edo, the visionary leader, and the man who loves Edo people the way he is. The man that has changed the face of governors. The one that will make you go to the hospital without any cover in your pocket and you'll be well taken care of because you paid your dues. Ladies and gentlemen, that is the governor we celebrate today. The DJ will lead us in the national anthem as soon as the governor arrives at 6. And his usual humility is going around to make sure that everyone is well seated. The national anthem of the Federal Republic of Nigeria is now. Follow the directive of Mr. Governor to be as brief as possible because he has so much in his hands today, and that for us is law. His Excellency, the Governor of Edo State, Godwin Nomengase Obaseki, my Lord, the Honorable Chief Judge of Edo State, the Honorable Justice D.I. Okonkwo, represented by the Lord, the Honorable Justice G.O. Imadu, the Head of Service to the Government of Edo State, Dr. Anthony Osaso Kombowa, Esquire. Honorable Commissioners and Special Advisors to Mr. Governor, and members of the Edo State Executive Council, permanent secretaries, heads of government ministry, department and agencies, and in particular, Dr. Rock Amego, the Director General, Edo State Insurance Commission for Health. We also like to welcome the Nigerian Union of Pensioners Chairman and members, led here by Comrade Samuel Okulegbe, the Nigerian Labour Congress, the Chairman, Chief Odion Laye, the Chairman, Trade Union Congress, Chairman, Nigerian Medical Association, Nigerian Bar Association, Nigerian Union of Journalists and Trade Union Congress, and indeed our very wonderful guests, the senior citizens of Edo State. Can you please warmly welcome yourselves? Your Excellency, before your arrival, gifts for all pensioners you have directed have been given. Their refreshment already has been given. If you have received yours, can you applaud His Excellency? And that is a testament. The head of service was in the course of giving his very cerebral opening remarks when the good news filtered that Mr. Governor is almost. And we had to pause in to be able to warmly welcome you. With your kind permission, can I request that the head of service will continue with his opening remarks, Dr. Anthony Osaso Kombowa. Ladies and gentlemen, your hands together.
Your Excellency, the Governor of Edo State, the most pensioner-friendly governor in the whole of this country. That's not my comment, though. It is your comment. Am I correct? So, if he's the most pensioner-friendly governor in Edo State, what do we say about the workers? He's the best governor in the whole of this country. I'd like to welcome Your Excellency warmly to this event. I'd like to also welcome my Lord, the Honorable Justice G.O. Imadu, who represents today my Lord, the Honorable Chief Judge of Edo State to this event, Honorable Commissioners, the Chairman, the Director General of the Edo State Health Insurance Commission, and everyone present, particularly our senior citizens, retired civil and public servants in Edo State, to be warmly welcome. Welcome. It is my pleasure to welcome Your Excellency and everyone here present to this program as we commemorate mark a significant milestone in the enduring commitment of Mr. Governor and the government of Edo State to the well-being of all those who have dedicated their lives in service to our great state. Today's event is not just to inaugurate a new initiative, but also to celebrate the ongoing success of the state government in the Edo State Health Insurance Scheme, a program that is making huge and very significant impact on the lives of public servants in Edo State. Today's gathering marks a momentous occasion as we enroll our esteemed Edo pensioners into the scheme that has proven to be a beacon of hope and empowerment, ensuring access to quality and affordable health care for every public servant in our dear state. Your Excellency, Mr. Governor, just before Your Excellency came in, I had mentioned that I am a recipient of several comments by civil and public servants across the board concerning the beautiful things, the benefits, the immense benefits that they're having from the scheme. And I expect that our retired civil and public servants will even have more from the scheme. The theme of this program, which is empowering Edo pensioners with healthcare insurance, access to quality and affordable healthcare, reaffirms the collective dedication of this administration to the well-being of our retirees. The essence of today's event transcends the mere enrollment check process of our pensioners. It also underscores the firm promise and commitment of this administration to uphold the dignity and welfare of our pensioners. These individuals, whose tireless contributions have shaped the growth and development of Edo State over time, not only merit our gratitude, but also the unwavering assurance that their health needs will continue to be met with the same diligence and care with which they did their work whilst in service. It is heartening to see the positive impact of the Edo Health Insurance Scheme on our civil and public servants. I am pleased to announce that at present, almost all our civil servants and public servants are beneficiaries of the Edo State Health Insurance Scheme. Government under this administration is very enthusiastic about extending these benefits to our beloved senior citizens. As we gather here, let us collectively assure our pensioners that their stories are already being reshaped for the better. The Edo State government remains committed to creating a future where every citizen, especially our pensioners, can enjoy their retirement years with dignity, good health, and the reassurance that their needs are consistently addressed. It is noteworthy to emphasize that this commitment is undertaken with the utmost benevolence of Mr. Governor, as the Edo State government bears the entire cost of this initiative, affirming our dedication to the well-being of our senior citizens. I keep mentioning civil servants, don't mind me. I want to express our heartfelt gratitude to the Edo State Health Insurance Commission and all stakeholders who have played vital roles in making this scheme a reality. From our dedicated healthcare professionals to the visionary leaders who conceptualized this initiative, your collective efforts have paved the way for a brighter, healthier future for our pensioners. May I also use this opportunity to express our sincere gratitude to the Governor of Edo State for the remarkable strides undertaken by the current administration in all areas of the public service. Under Mr. Governor's absolute leadership, this administration has demonstrated an unwavering commitment to addressing the long-standing challenges pertaining to the government's financial obligations in terms of pensions and gratuities. It is with great admiration that I commend the exceptional efforts being made by Mr. Governor and the government of Edo State in tackling the perennial issues surrounding pension and gratuity payments. In a landscape marred by the historical burden of pension and gratuity and death benefit arrears amounting to billions in naira, this administration, under the prudent stewardship of the governor, has dealt with the issue of pension arrears, stabilized the pension payment system, brought workers into the contributory pension system or scheme, and has instituted a groundbreaking monthly payment plan in the form of a very audacious effort to defray gratuity arrears by setting aside the sum of 200 million naira monthly for the phased payment of gratuity to pensioners. This plan stands as a testament, it's no longer a plan, it's been implemented already, to the administration's dedication to resolve the protracted challenges inherited by this administration which are faced by the pensioners. Moreover, the current administration has undertaken a comprehensive restructuring of the pension system. The visionary initiative marks a historic departure from conventional practices as it introduces a seamless transition of names from the salary payroll to the pension payroll upon retirement. The transformative step represents a pioneering and groundbreaking effort in the Nigerian governmental landscape, setting a precedent for efficient and systematic pension management in Nigeria. The impact of these initiatives extends far beyond our state shores. The innovative approach adopted by the Edo State government has become a model for emulation by other state governments across the nation. It serves as a beacon of inspiration for those seeking effective solutions to the intricate issues surrounding pension administration in Nigeria. In acknowledging these accomplishments, we recognize that the current administration's commitment goes beyond mere rhetoric. The tangible results achieved in settling pension arrears and revolutionizing the pension system attest to the dedication of Mr. Governor and his team to the welfare of our retirees. The Edo State Health Insurance Scheme is not just a program, it is a testament to our commitment to providing comprehensive health care to all public servants in the state, and more importantly, to our pensioners in the state and all Edo people. In the spirit of empowerment, this administration is of the view that good health is not a luxury, but a fundamental right. Through this scheme, government seeks to eliminate the barriers that pensioners may face in accessing quality health care, ensuring that they can lead fulfilled lives, and with the assurance that their well-being is our top priority. As we enroll our pensioners into the scheme today, let us reflect on the significance of the moment. It is a demonstration of the synergy between government, society, and the people it serves. The Edo Health Insurance Scheme is a bridge that connects us to the future, where no pensioner has to bear the burden of healthcare costs alone. It is the commitment to the site that values and supports its senior citizens. In conclusion, let us embrace this day as a symbol of hope and progress. Together, we are taking a bold step towards a more compassionate and inclusive society. The Edo Health Insurance Scheme is not just a policy, it is a manifestation of our shared values and our belief in the inherent worth of every individual. May this initiative bring comfort, may it bring peace of mind, may it bring improved well-being to our senior citizens, ensuring that their twilight years are filled with the care and attention that they so deserve. Let us also collectively applaud the foresight and tenacity demonstrated by Mr. Governor and this administration in transforming the landscape of pension management in Nigeria, indeed, the landscape of development in this country. May these initiatives continue to serve as a catalyst for positive change, not only within our state, but across the nation. Thank you, and God bless you.
Digital Head of Service to the Government of Edo State, Dr. Anthony Osaz Okungbowa, Esquire. Thank you very much. I will appeal that we be very brief and speak to our established paper that we may have. I'd like next, Your Excellency, to invite the Director General Edo State Health Insurance Commission for a brief overview. Dr. Rock Amego. Ladies and gentlemen, your hands together for this great man that have made Edo so proud.
His Excellency, sir, may I be given the permission to stand on the existing protocol? Thank you very much for coming today. Today, I stand before you with a great sense of excitement, gratitude, and pride to acknowledge the kind gesture of Edo State government for including and making provision for free healthcare coverage for old and existing pensioners across the 18 local governments of the state. I want to please ask you to please join me while standing as we give His Excellency a round of applause for this beautiful initiative. Thank you very sincerely. You may have your seat. Let me take you through a journey on how we started. We're aligning with the inquiries and the feedback we got during our operations, and then I'll take you through a journey to our future. There are three main considerations I'd like to talk about here. In the year 2019, I was appointed as the first Director General of the Edo State Health Insurance Scheme. And at the time of my appointment, we had about 90% out-of-pocket spending on health expenditure across the country. Today, NHI has been reformed and it's now called NHIA instead of NHIS. And our out-of-pocket spending nationally stands at between 70 to 80%. At the time we were appointed, when we came in, we were all fresh, we were new, we needed to know what was happening in the insurance space. And so we did a national tour and also a continental tour. We went to about 9 states. We went to Rwanda, we went to Kenya. The reason we chose Rwanda was that they had about 80% coverage, the highest in the Africa. So we needed to know what they were doing so that, we can take a leaf from their experiences and adapt it. We also went to Kenya because Kenya started their health insurance in the 40s, 1948 to be precise. And so we just wanted to see what they were doing so that experience will form the bedrock upon which we lay all our procedures. We also sought the services of an actuaries, Ernst & Young. They are foremost actuaries in the country. And they are financial advisory. What they do is that they come, look at the market space between private and public, and they give you a price cap and the benefits that's going to exist in your benefit package. They did an assessment of health service provider across public and private facilities, and so they gave up the price that will be feasible, across various boards. They also factored inflationary measure at the time. I must confess to you that we were advised by His Excellency because of the dynamism of our economy. And so about a 15 to 40% inflationary measure was added to our premium. When we started, a lot of people were complaining, willingness to pay and ability to pay. Our premium is the highest. But today, looking back, we want to thank His Excellency again for giving us that drive to add that inflationary measure. If you look at the economy, we thank you again for helping us so that our health insurance will be sustainable. Our second consideration was that we needed to make our health insurance smart. And so we did an end-to-end ICT from enrollment to accreditation to patient encounter to claims. And we also draw our management risk policy. While going from place to place, we were enlightening citizens to join the Edo State Health Insurance. One of the questions that was pertinent that people kept asking that, you have gone to this place, you have done beautiful framework. When this governor go, how am I going to do them? What are you going to do? Will this team continue? And so we showed them and said that this scheme was legislated by law and that it would exist after the government as long as the objectives and the provisions within the laws are right. The second consideration that we had was that during the implementation of the health insurance, we started in July 2021. We noticed a particular trend. People kept talking about out-of-stock syndrome. What that means was that we're always having drug unavailability within the facilities. And so we set up a think tank team within the commission. And so they came up with a short, medium, and long-term fix. Of course, the long-term fix was manufacturing and producing drug. And at the time, we told His Excellency, who in principle gave us a land in Osioma where we can start production, of drugs and services. But, we had a lot of things. But we needed to know that, for the immediate, the short and medium term, these people had to have drug. And so we accredited private pharmaceuticals across the 18 local governments. Our implementation research at the time showed that out of drug stock in the hospitals was 65%. And as soon as we started engaging pharmaceuticals, so that when you give a prescription, you don't have it in the hospital, you can go to the pharmacy. We realized that the value dropped down to 4%. People were afraid of losing their money, as it were. All right? So people started going to pharmacies where there were drugs given. We also engaged other stakeholders across board. And then another pertinent, frequently asked or inquiry that came was that His Excellency is paying for our health insurance and is contributing 50%. If you are in the public and civil service, you see that every month a certain amount is deducted from your salary, and His Excellency matches it with 50%. So we kept getting this question over and over again. In our active years of life, the governor is supporting us, he's paying for our health premium. When we retire, what are we going to do? Who are we going to meet? Who are we going to cry to? Does it mean that we've been left behind? Today, ladies and gentlemen, a reality has come to fruition. Your Excellency, sir, the impact of providing healthcare coverage ushers this state into an era of inclusivity, compassion, and empathy. This decision you have made sends a message to our civil and public service, making it much more interesting for the best minds to come and work with us. And it further shows that the contribution of our pensioners have not gone unnoticed. Thank you very much, our pensioner. My mom is here, it's also a part of the pensioner. Thank you for the contribution you have done in our state. By this gesture, Your Excellency, sir, you have safeguarded the dignity of every pensioner. You have safeguarded the independence of every pensioner. And ultimately, you have safeguarded the quality of life of every pensioner. You have set a message that age is not a barrier to receiving the absolute care that you need. Let me use this opportunity to tell every pensioner across the 18 local governments of the state to take advantage of this opportunity and get enrolled into the health insurance scheme. If you look at the memorabilia or the gift that's given to you, details of how to enroll is within there. Our addresses, our phone numbers, our office address are all written there. And then you also have our people who are branded with the Edo State Health Insurance Scheme. After the event, enrollment has begun and will also continue. To the Governor, His Excellency, Godwin Nogagasa Obaseki, we once again express our deepest thanks and express our commitment to working smart, to working hard, and through collaboration and partnership, we'll make this health insurance a resounding success. Thank you for listening to me, and God bless.
Ladies and gentlemen, can we give Dr. Rock Amego, Director General of the Edo State's Health Insurance Commission, that is doing so well. The testimonies of our pensioners has loud for everyone to hear. Today, an opportunity will be given to them to also make few words on their personal experiences. Your Excellencies, very distinguished guests, ladies and gentlemen, I'd like to invite for a brief speech the Chairman, Forum of Chief Executive Officers of State Social Health Insurance Agencies in Nigeria. He's also the Managing Director of the Anambra State Health Insurance Agency, Dr. Simeon Yemechi. Your hands together for him, please.
Your Excellency, Governor Godwin Obaseki, my Lord, every other protocol very well established already. I bring you greetings, Mr. Governor, from the Forum of the Chief Executive Officers of Health Insurance Schemes in Nigeria. We are an umbrella body registered with the Corporate Affairs Commission, and our aim is to promote issues of universal health coverage across Nigeria, looking at the subnationals, working together as a unit to ensure that no citizen of Nigeria, because we do not have any federal citizen, is left behind with regards getting access to affordable health care that is of sufficient quality to be effective. That is our mandate as a forum. We bring you greetings, sir. First is to say congratulations, Your Excellency. In our forum meetings, we usually will assess ourselves. Where are we? What state is doing what? The first time we tinkered with the idea in the forum of saying no state health insurance scheme in Nigeria should continue to patronize third-party administrators. Let us build capacity of our civil servants for sustainability. Dr. Rock Amego in that meeting said, you know what we are just thinking about? My governor directed when I went to discuss issues of third-party administrators that, look, this is not sustainable. The administrative costs that we're going to incur, even beyond what we were discussing as experts in the field. He said to us that you said all of those and that he should drop that idea. And today, Edo State Health Insurance Commission is going to be sustained after you leave because you took that decision. We are very confident that this state is in safe hands after you leave, at least from what we hear from Dr. Rock Amego during our meetings. He is quite energetic and very visionary. A couple of things have happened in Edo State. One is today thinking about what the line of our national anthem speaks to, the labor of our heroes past. We should not forget it. Politicians think absolutely of the next election. I'm not here to eulogize you, Mr. Governor, but statesmen think of the next generation. Those in the civil service today will look forward to life in retirement after they leave. Most of what we talk about, people are not sure of what will happen to them when they leave service. You have taken care of that. From the point where I stand, I know clearly, being an expert in the field, at my doctoral degree level, I worked clearly on health economics. I know that this initiative will not cost you minimum 2.5 billion naira every year, and you're committed to doing it. Why this is very important is that life expectancy in this part of the world is currently put at 55 years. Those who are pensioners today have managed to cross 60 if they retired at 60, and for some others just before that time, because they have met their 35 years mandatory service. But many of them, not for any fault of theirs, but for aging, live with lifestyle modifiable diseases, hypertension, diabetes, and they die from preventable deaths because they do not know where the next money will come from to keep up with buying their prescription drugs. With what you have done, they will not think about that. The ripple effect of it is that more money will be made available for them to now live better quality of lives, and those who they depended on to procure their drugs will have even more money. The entire economy, looking at the velocity of money, will benefit way much more from the impact of what you have done today. This decision you have taken, the forum is very proud to say that there is a governor who is thinking about health in Edo State. Policies of government are just flashes in the pan. Institutionalizing governance, which is what you have done through legislating on this scheme, and the things you are doing, gives us hope that universal health coverage will be attained in Nigeria. When we have more of these, we are very confident. Looking at the fact that they have run a fully digitalized system, we are not so many states in Nigeria with end-to-end digital systems. Anambra is one. We pioneered it, but Edo State was the third to do full end-to-end. And across the country today, end-to-end health insurance schemes, we are just 9. We are encouraging all of our states to get to the end, but then you are doing end-to-end. That tells us clearly that administrative costs will go down. Technology will drive what we are doing. Data science, which they have embedded in their office. When I visited today, I was very impressed. We have a lot of hope that you have taken on this young man like ourselves who is pushing your agenda through. We hope ultimately that one state at a time, universal health coverage will be attained in Nigeria. Thank you so much. We are grateful for what you are doing. May God bless you.
Ladies and gentlemen, please have a handshake with Mr. Governor. Can we put our hands together for Dr. Simon Oyemachi? It is indeed no longer story that Edo is getting it right. And I'm happy that our people are beginning to understand what this governor was doing at the onset. Dr. Simon, if you want to eulogize him, eulogize him. He already has it on plaques. The best ICT governor in Nigeria. The only governor that has institutionalized paperless document is in Edo State. Fiber optics in the entire 18 local government. I'm sure you have not been paid December salary. Civil servant in Edo has been paid since on the 10th. And they are expecting another one before 27th for New Year. Only this governor has done that. If you have received your alert, clap very well. Okpomese. Ladies and gentlemen, you are doing well. And we are proud to identify with you. Next door neighbor, Delta, are you aware that when you retire, how many years do you wait before you get your first pension? 3 years. Go and fact check. You retire in Delta State, they receive more money than Edo. Fact we show. 3 years before you receive your first pension, not to talk of gratuity. But in Edo, you retire in November, you receive your pension in December. It's autopilot. Mr. Governor, there are times you have to be proud of yourself and blow your trumpet. When you keep quiet for too long, people take you for granted. You are already setting the template for the next 30 years. And so my ladies and gentlemen, your hands together for our great governor. Just because of time, we have several pensioners who have indicated interest to talk. There are so many. Look at the hall, filled to the brim. Some have been waiting here since 9 a.m. God bless you for your patience. But I will invite the 6 we have assigned to stand with only the one that will speak because of time. Ugbo Omorege, the comrade, will be speaking on behalf of... Can we have the other 6? Do they know themselves? Otherwise, you will not speak, but the governor will see you. The cameras will see you. It will be assumed you have spoken, because you are all going to give the same testimonies. And you know this governor works with time. If you are not cerebrally smart, so you have to be smarter than normal. Please, your hands together for comrade Ugbo Omorege. Move closer. He will be sharing his testimony. He's old enough to speak for himself, the Bible said.
Well, thank you very much. I'm grateful to the state government, I'm equally grateful to the health insurance. When we enroll into the health insurance scheme, at the beginning, no civil servant will want one kobo to be deducted from his salary. But I had the malaria. I and my wife, we went to St. Philomena Hospital. I went for X-ray, I went for test. At the end of the day, I paid 3,500. I said, these people, are they going to deduct it from my salary? At the end of the month, nothing was deducted. Then August last year, about 2 months to my retirement, I had a problem that needed surgery. I went to St. Philomena Hospital. I went there. They carried out the surgery. At the end of the day, I paid nothing. Though I was their internal auditor. I said, is it because I was their internal auditor they were doing this? Then after retirement, June this year, I called the DJ. I said, I'm still going through hair. I cannot afford. He said, do I not have insurance? He said, go back to the insurance. They sent me to Echo Hospital. They carry on that surgery. I pay nothing. I want to be grateful to Your Excellency and the Director General. Thank you very much. And Morlink Health Insurance.
Can you put your hands together for comrade? Please approach Mr. Governor for a handshake. No, go and take a handshake with Mr. Governor. That's what he loves. Ladies and gentlemen, can you applaud this wonderful initiative? Spectacular initiative. And just before Mr. Governor arrived, we had another testimony. And this testimony was witnessed by the head of service, that one of his staff came to break the news that he's got a new baby. And they were happy. What was his second testimony? That the wife had a CS and that man paid only 3,500. Can you imagine that? Because Governor Baseki saw tomorrow yesterday, and we are all witnesses of that today. It is my singular honor at this point to invite the man of the moment, His Excellency Godwin Nogega Setwa Baseki, the Alagoda governor, the pensioner-friendly governor, the health insurance governor, that is making the people of Edo proud of their government, that is making pensioners proud. All pensioners are able to do their Christmas because Mr. Governor have already paid well ahead of time. Can you make some noise?
Thank you. Good afternoon. And first, sorry for keeping you here this long, but I believe that it is worth it. So let me start by acknowledging the Chief Judge of our great state, who is ably represented by Justice G.O. Madubelo. The head of service, and we thank God for him, because most of what we are celebrating as reforms today in our civil and public service may not have happened if I did not have an energetic and courageous head of service. Oftentimes, it's only the head, the governor, that gets all the accolades. People forget that there are people around him that make it possible for him to receive accolades and be acknowledged for the work. Honorable commissioners who are present here this afternoon, permanent secretaries, the Director General of the Edo State Health Insurance Commission, Dr. Rock Amigo. I remember when the idea of health insurance came up, and I said, how do I get somebody who can understand what we're trying to do to come and run this agency? I looked around. Fortunately, he's quite close to me in terms of our family background, families. And I called him and I said, come, there's an assignment for you. And you know how these young Edo professionals are. No, I don't want to have anything to do with government. I said, please come. I'm not saying come into government. Come and just try. If you don't like it after 3 months, you can go back. Take a leave of absence from your hospital in Abuja. He took a leave of absence, came in, and started the assignment. And by the grace of God, today, we are celebrating the work of this young man. I want to also acknowledge our partners in this government. You see, I have had the benefit and privilege of working with a group of people who call themselves comrades. I'm not a comrade, and I cannot be a comrade because I'm on the other side. However, I share so much with them because these are people who are not just there for themselves. They are there to serve their constituencies and the people they represent. And that is what I believe in. That when people say, go and help us serve, go and serve us, go and work for us, the moment you have that responsibility, then you must drop everything else and work for those people, not work for yourself. And that is what we are trying to do in the government of Edo State, even though I am not a comrade. So I want to acknowledge the chairman of NLC, the chairman of the Nigerian Union of Pensioners, and all other labor leaders. I see chairman of NOGE, the chairman of MBA. I don't know, you're chairman of what? Broadcasters or? And all of you who have come here this afternoon. Compliments of the season, and Merry Christmas in advance. Waselugwe. I'm indeed really honored to be with you, my friends. I call pensioners my friends because we have come a long way. From the very early days when I got into government, when you used to wear black, for Labor Day parades, And today, to a period where you started wearing white. And now you are wearing your normal clothes. So I want to thank you and say, look, I really, truly appreciate you. Because you mean so much to us and you mean so much to this country. We take so many things for granted. And as the chairman of the Association of Medical Insurance Practitioners, CEOs in Nigeria said, that's sentence in our national anthem, which is, may the labors of our heroes past never go in vain. People worked to build this country. Whatever we are enjoying today, people made it happen. Nigeria did not start today and will not end today. So those people who built this country, built our states, built our organizations to where we are today, it will be unfair, it will be a sin to God and man not to remember their efforts. Even though things are not working the way we expect them to, it is not solely their fault. And that is not enough reason why we should not acknowledge them and care for them. Because if we don't, one day we will be old too, and we may not find people to care for us. That is why, as a government, we took it as a priority to ensure that we take your interests and put those interests in the front burner as government. We're not only concerned about those who are working today and producing for us, we're even more concerned about those who have worked. Because those who are working today are also looking into the future. And the way we are treating those who have retired would likely influence how they will react and respond, because they will have to make decisions. Do we take care of ourselves now? Because nobody will take care of us tomorrow when we leave. Or we shouldn't worry. Let us give everything now, because if we do, there's a system that will take care of us when we leave. And so that is why we transformed our pension arrangements. I remember my first encounter with the unions. I got sworn in November 2016, and I said, January 1st, 2017, we cut over straight to the contribution pension scheme, right? And the unions, you know how these comrades are. They started trying to protest. I said, no, it is non-negotiable. Today, are we not reaping the benefits? We have in excess of 5 billion naira already contributed under the contribution scheme. And for those who could not qualify because of their age, we then decided to undertake the actuarial valuations to understand the liabilities. For 30 years, they were not paying gratuity. But by the grace of God, we have started clearing the backlog. In fact, this morning, I just approved the gratuity payments for almost 400 local government workers. So, ensuring that they get regular income is a priority for us in government. That the fact that you have retired does not mean your life should end. So if you retire, and it is an offense if 6 months to your retirement, you do not start to put your papers together so that all your papers can be ready by the day you are retiring, such that the following month, you're already on the pension list and you start earning your pension. That's what we've done for pensioners in terms of income. We know it's not enough, but we've entered negotiations with you. We've done some adjustments, and I know very soon we're going to sit again to discuss further adjustments because of inflation. We sit back and say, okay, pensioners, what really is their main cost? It's like we're human beings, or like machines, we're like vehicles. After a certain age, you begin to repair the parts. Yeah? There are things that will not work as they used to. So health care is one of the major costs that pensioners face. And do we just leave them like that? How do we care for them? How do we ensure that they are taken care of? And they don't spend a large portion of that little amount you are giving them to be paying hospital bills. That is why we decided as a state that we will now include pensioners in our health insurance arrangement. For those of you who may not know, in 2017, I brought Dr. Rock Amigo and said, look, as part of our healthcare reforms in Edo State, we must now not deceive ourselves and say, government alone cannot pay for healthcare. People must contribute. That is how we came about the health insurance arrangement. And now it is an offense in Edo for any employer, anybody who employs more than 5 people, not to have health insurance for those people who are working for you. Because if they are sick, what happens? They will go to native doctor. They should be able to walk into any hospital, any primary health care center to receive treatment. And for us as government, we have to make those places available to them. Government alone cannot provide all the hospitals. But we believe and we know from the data that we have enough hospitals, pharmacies, and areas where you can go and get treatment in Edo. And that is what the health insurance agency has been doing, to try and go and check everybody who says a doctor or is a hospital or is a clinic. Go and see what they are doing there. Make sure that they are providing real healthcare services, and then we register them so that if you are sick, you can go and receive treatment, and the health insurance agency will pay. We're also ensuring that it's not every hospital is a hospital. We have to be convinced that you can give a certain level of care, that you have a qualified staff to do so before we allow you go into those places. We have spent over 4 years to just go through every health institution in this state diligently. That's why we as government now are saying, we don't have general hospitals again. We don't want to generalize hospitals. We are focusing on primary health care centers, clinics, so that you don't have to walk more than 5 miles from your house to be able to get care from our PHC. And in each of those centers, we have also looked and said, what is the problem? Why is our health bill high? Most of it is drugs. And making sure that even the drugs they give you are original. So we've gone back and looked at the drug arrangements, so that when they finish treating you and you go to the pharmacy to collect your medicines, they don't tell you, OS, out of stock. No. We have made arrangement that there must always be stock in the facilities we use. In Edo, at least under my watch, we don't talk much. Because over the years, people have talked and talked and talked. But you don't see it. We make sure we do it first, as you've seen, and before we begin to talk about what we're doing. Because we are not here to deceive our people. We are here to work for them, because God has given us an opportunity that we must use well. So all those people you hear criticizing, abusing us, you can see the reason why they are doing so is that the money we are spending to do all of this is what they used to chop before. They are not happy. So any of them complaining about this government, just ask, okay, what is your real work? What do you do? At the end, you just find out that they were the ones who used to be around government, making money from government without doing anything. So that is the quarrel you are seeing. It is not about whether the benefit package we're giving you today is adequate or not. They are not interested in that. They are not interested in what we are doing. For us, we are doing nothing. We're only going to do something if we give them the money for them to chop. Are you going to let us do so? No. They are coming again. We will meet them when they come. So this afternoon, I'm just here, as usual, to say, what Christmas present can I give my beloved pensioners? We thought about it. I said, federal government has the basic healthcare provision fund, but it's not enough. These are people who have worked. I said, how much will it cost us? Let us look for the money. And let's now make sure that if you are a retiree in Edo State, please come and register for health insurance. Because you have served, it is free to you. Our government will pay for you. We will pay your premiums. Is that clear? So that you don't walk into any facility and they say, we bring money for card. No, the card is already with you. You understand? It's not that you go when they finish, you see a doctor, they will give you prescription. When you get to pharmacy, they say OS. No, the S is already there. Is that clear? Retirement should not be a condemnation to death. We want you to retire and live another 50, 70 years. So that we can continue to enjoy you. I know the service, the advice, and the support which many of you give to us. We love you and we want to keep you. We are not concerned about what else is going on outside Edo State. We are concerned about Edo and you. That is our priority. So I want to join you to thank and congratulate the Director General of the Edo State Health Insurance Agency and all his colleagues who have worked tirelessly over the years to make sure that this scheme sees the light of day. And that this scheme, as the President said, is one of the most respected in Nigeria. From January, I'm going to be doing something that is not too good, though. I'm going to be going around every company in Edo to check whether they have registered their staff in the health insurance. Anyone that does not register, we will bring out the law and we'll make sure that we will implement the law to the fullest. Is that clear? So we are going to be putting out a hotline to numbers. Just phone us and tell us we are working in so and so place. The person or the company employing us has refused to give health insurance to us. Leave the rest for us. We know what to do. Is that clear? So I want to, on this note, thank you